I've been watching 1049 here for probably about 20 minutes, and I'm really thinking she's in very, very early labor. Now, her udder tends to feel a little bit differently because, like, she'll really engorge once she has the kids. Now, her udder's really big right now, but she'll really fill out. But yeah, I've been watching her, and she's a few days. She's about 3 or 4 days past my written due date, but she's just kind of been nickering, kind of talking to herself, and her eyes are kind of bugging out of her head, and she's kind of gotten, you know, what I call hunchy butted here a few times, and she's just really restless. Yeah, I know, Mom. Yeah, I know. Yeah, so, I mean, I don't think it's going to be in the next 20 minutes, but yeah, the whole her talking to herself is new. She wasn't doing that before, so I think I was hoping to maybe catch an early contraction, but she's just been really restless and walking around, just kind of wandering, doing a lot of the squatty potties. I don't know if you caught that, but lots of squatty with very little potty. So I don't know if you can hear her on here, but she's just kind of talking to herself. And Brandon just cleaned out the shed. Like, we are bare floor, and it's really, really, really chilly out today, and so I'm not super crazy about opening up all the doors. I know, Mom. Open the shed wide up just to throw the bedding in, so I might give her a few more minutes and see what she does, and then maybe we'll try and rush some shavings in here or something so she has something warm to bed down on. Yeah, is it time? Is it time, Mom? Yeah, you're good, Mom. So we'll just keep an eye on her and see what she does. Kind of thinking it's time. So I forgot my fancy earphone thing again, but I don't want to miss it. Oh, there we go. Oh, whoa, you okay, Mom? Oh, praise Jesus, a doe kid. Oh my goodness. Are you okay, Mom? Yeah, she was stuck. She's a pretty big little girl. Yeah, come give your baby some loving. Oh, it's a doe. Oh, thank goodness. At least we got one doe. Huh? We got one pretty girl. What a pretty girl she is. Yeah. She just started pushing. Like, I had only been watching her for just a few minutes, and I shut the camera, or I was watching inside, and I shut it off my phone, not thinking that anything exciting was going to happen quite yet, but I was wrong. And you're just right here, aren't you? You're just ready to go. Well, you made that look pretty easy, 1049. You did. You made that look pretty easy. You gonna push out another one? You're a pro. So I trimmed the umbilical cord. Let me back up. So I realized after last year that, see, obviously my life happens in chronological order, so I don't think to explain in all these videos what it is I'm doing or why it is I'm doing what I do, because, well, I've already explained it, and so I just assume that anybody that has seen the videos already knows that, but that is not always the case. So I will try and be better in every video about maybe explaining what it is that I do. So normally her umbilical cord it just must have ripped, and so it's short enough. But normally I trim umbilical cords to about a half inch to an inch is fine, and then I spray with iodine. Really, I'm just trying to. This is just gentle iodine. I'm just trying to close up that hole. You know, that umbilical cord is just like an open tunnel straight into their bodies, and so you want that to dry and close as quickly as possible. And so you don't have to do it, but I mean, it is possible for bacteria to get up in there. So that's why I like to do that. All right. What I just gave her was Boce. It is selenium and vitamin E. It is a high concentration of such, and I'm confident giving this to my babies because we live in an area that is selenium deficient, and so this is something that we give in low doses in a with relative regularity. But if you ever have a kid who doesn't have a strong suck reflex, is having trouble standing, you would be surprised how much of that is linked to selenium deficiency. And so, oh, here we got another one coming. And so we give all of our mature does at least 1 cc of Boce subcutaneously every 3 months. But then when the babies come out, I give them a 1/4 cc subcutaneously. Yes, hi, baby. Here, you can sit down behind me. Sit down. But then next, and again, honestly, you probably don't need to, this is just what I do. It doesn't make it right. This is just how I do things. I find it works really well for my animals, and so this is what I choose to do. I like to also give them a 1/2 cc of B complex. Again, it's just a vitamin shot. That is to just help stimulate appetite, just to help it get going. This one, I give a 1/2 cc. B complex is water soluble, and so you would have to. This is passed out. Whatever they don't use is just passed out in their urine. So you would have to give an ungodly amount, I would assume, to do damage, to actually hurt an animal because it's water soluble. So, good job. Look at you go, professional baby. Look at you go.
See Lisa.
I would imagine.
See, I really
Oh yeah, there's a little somebody right there. Stay here. I'm gonna try and get little girl. I know, what a good mama you are. You do such a fine job.
So that grandma is turned into a mom.
Well, no, she's not a grandma. She's just a mom. Well, I mean, she is a grandma, but this is her baby.
Yes, technically she's not a grandma anymore. She's a mom. Did we buy this stuff?
We bought all these. Well, some of them we free.
Look,
Yeah.
there's a baby dog. But I just moved it right to pieces. Mom? When you're done with these, with these syringes, I also put them in my blue zipper pocket. And so you're gonna throw them in the trash. Put them right here.
Oh, honey. I was still using them. I had them set out in a certain way for that. Yeah, it's fine. Here. It's fine. Yeah, just Mom usually has a reason why I put things in a certain place. Okay? Yeah, I had them all set out the way I needed them. It's okay. Don't worry about it. Mom will just get new ones.
So, Mom, what order do you want it?
It's fine.
So, how is he on what the babies when they first do when they get born?
What do you mean? What are you asking?
Like, what do they do when they're first born?
Babies? Well, they have to nurse.
Oh, so the mom wakes her and all that.
She dries her off.
So,
Oh, there's another one
like
coming.
in the wild.
Yep, this is what they would do in the wild.
Yeah, but they have to have it quick
They do. They have to have it quick in the wild.
because they're attracting predators.
You're right. They would be attracting predators.
Because they want to eat the babies.
Well, and the mom's down too, so you're right.
Do you know what's tastier than a full-grown baby?
What's that? We got a girl. A good-looking girl too.
What?
A good-looking girl too.
Full blood, right?
Yep, full blood.
Yes, you got a girl. And we got, hey, and you got this last baby. You got the
There's a baby. Yep, it's just blood.
There's another coming
Yeah,
out.
there's another.
Stay back,
He's
Mason,
locked
no.
and loaded.
Stay back there.
Here, everybody back here.
Yep, get a little bit of space.
Look, I can't.
You can stay back too. Give her some space. Everybody stay back here.
But Brett, he doesn't have a beard.
Here, I think we're gonna try and speed things along just a little bit. It's a little chilly in here.
Guys, don't be chasing the baby.
It's not chilly in here at all.
Well,
For
we have
a
two
wet
coats on
baby.
for a wet baby that needs to get their tummy full. We'll see how she does.
Oh,
Yeah,
don't
no.
don't stand on baby, Mama. Jackson, don't chase him.
They got two towels.
Here we go.
Is it a boy or a girl?
It's a girl!
I was right!
Yay!
Towel maker.
It's a girl. Dry her off.
Get her face.
Yeah, hold on.
Get her face.
Jackson's like, nope. Oh, two girls. Yay!
And we were right.
Yes.
Let's
Here, you're in the way, baby. Here, scooch over.
let's talk for these babies.
Yes. Thank you,
My
God.
prayer. My
Yes.
prayer.
Well, everybody is doing marvelously. Yeah, these two have nursed, and they've nursed a lot, and they've been up, and they're just two good-sized, healthy doe kids, and she made it look easy as usual. And yeah, I mean, overall, this is how you want it to go. This one's a wrap.